Hello and good afternoon. Welcome to our very first Ask a Nurse virtual forum. My name is America and I'm the Communications Coordinator for Immunize Nevada. Immunize Nevada is a statewide nonprofit dedicated to promoting health and preventing disease. As our state, our country, and the world faces a pandemic, it continues to be our mission to connect Nevadans with the knowledge and resources they need to make the best health decisions for their families. I'm thrilled to be joined today by Jaime Young. Jaime is a registered nurse and is currently working to obtain her doctorate in nursing. She serves now as an intern for Immunize Nevada, and her knowledge has been invaluable at outreach events and clinics. Jaime, welcome, and thank you so much for joining us.
Hi, America. Hi, everyone who's watching. Like America said, my name is Jaime. I'm a registered nurse. I've been a nurse for 10 years now, and I'm currently going to school to get my family nurse practitioner degree as a doctor of nursing practice. And I just wanted to be available if anyone had any questions about COVID or any other kinds of health concerns. Not that I know everything, but I've got some knowledge that I can share with you.
Well, we appreciate you taking the time, and we're so glad that you have been doing your internship with us. Let's go ahead and dive in right into the questions. Our first question is, what is the difference between COVID-19 and the flu? I think we hear a lot of times that some people have said, maybe early in the beginning, that, oh, COVID is just a bad flu. Tell us the difference between those two things.
So there's a lot of things that are similar between the coronavirus, COVID-19, and the flu. They're both respiratory diseases. So that means when somebody talks, sneezes, coughs, they spread the disease to other people when you breathe it in. They both have really high fevers. The difference is the coronavirus causes a lot of respiratory symptoms, which means shortness of breath and a cough, whereas the flu causes more like body aches and the fever. They're also finding that coronavirus is much more contagious than the flu, which means more people are going to get the coronavirus when they're exposed to it. And they're also finding that people die at a higher rate from COVID-19 than they do with the flu. So it's highly infectious, highly contagious, and it does have bad outcomes. So it is a more rough disease than the flu, I would say.
Right. So why are they making people stay home? So obviously we've been under a stay-at-home order from Governor Sisolak. Why should we be staying home right now?
Staying home is the only way that we can slow the spread of coronavirus. There's no vaccine to prevent it, and there's no proven effective treatments for coronavirus. So therefore, the best thing that we can do is help slow the spread. Everyone is going to be exposed to it eventually, and that's okay because we'll get an immunity to it. But when everyone's exposed at the same time, we don't have enough beds in our hospital for everyone. So that's why they talk about flatten the curve, slowing the spread. It's not like one person's going to get sick out of five. Five people are going to get sick out of five with it. So they want to make sure that there's enough beds in the hospital and enough healthcare providers in the hospital. And that's why everyone stays home.
That's important. Yes, absolutely. Why is it important to wear a mask in public? I think there was a little bit of confusion in the beginning. Early on, we were told maybe not to wear a mask, and now the CDC has kind of shifted and has asked folks to wear a mask outside. Why would that be important for people?
So that's important right now, not to protect yourself per se, but to protect everyone around you. They're finding that a lot of people who have coronavirus don't show any symptoms, or they show really mild symptoms and don't realize they're sick. And those are the people that's spreading the coronavirus quickly to other people. If everyone wears a face mask, that helps prevent you from spreading it to other people, along with proper social distancing. So staying 6 feet away from people you don't live with. That'll help slow the spread because we still need to go to grocery stores, and there's a lot of people in the grocery stores. So if you wear a mask in those areas, that helps them. And it's not the same. You don't need to wear an N95 mask like they do for healthcare providers. That's for healthcare providers who are doing very invasive procedures. That's putting them at higher risk for doing coronavirus. The cloth masks are so we don't transmit it to everyone. So that's why we need to make sure that all people are wearing masks when they go out.
Awesome, thank you. Yeah, that was something that was a little bit confusing for folks in the beginning. I'm glad you kind of figured that all out. Does wearing gloves work as well as washing your hands? I think you see a lot of folks wearing gloves in the grocery stores and while they're out, and while that might be effective, does it work as well as washing your hands?
I actually think that washing your hands is a better option When people wear gloves, they tend to wear the same pair of gloves for everything. They go to the grocery store, they go to the drugstore, they go to the doctor, they're wearing the same gloves, and they think they're protected. And they're touching everything, and they're spreading that disease to other people. So even though the person wearing the glove might be protected, they're actually spreading the disease to other people. Whereas when you wash your hands, you're much more conscious of what you're touching. You're more cautious of washing your hands after you touch things. I know that after I touch the door at a store, I wash my hands, and then after I touch something else at the store, I'll wash my hands. When we say wash your hands, hand sanitizer works well. We know there's not sinks and soap everywhere, but you should wash your hands with soap and water when you come home and have a sink available for you, because it's just shown to be the most effective way. So gloves are okay if you're actually going to take your gloves off between every store, but washing your hands, I think, is a better option.
It's very interesting how this, kind of more basic rudimentary public health directive of washing your hands has kind of been, just so much more important and on the top of people's minds when it comes to preventing the spread of disease.
Yeah.
Could you maybe shed some light on exactly how COVID-19 is spread?
So COVID-19 is spread. There's some talk whether it's airborne or droplet, but the easiest way to know is it's in your breath when you sneeze, when you cough, when you talk to somebody. We're all making a little spit come out, which we can't see, but virus can go in it. And then the person next to you is breathing it in, and then the virus is in your lungs. And so you have the virus after that. So that's why they say do social distancing and wear the cloth mask, because that helps prevent the spread. You can also spread it by somebody coughs on their hand and then they touch their table, and then you come around, touch the table, and then you touch your face. That can also spread the disease. So that's why hand washing is also really important for us to do, because you can ingest the disease and it gets there too. So anytime you touch anything that's contaminated, or anytime you breathe in something that's contaminated with the virus, that's how you catch the virus.
That's really, really good to know. Maybe that's why they're also telling folks to be careful when, sanitizing your countertops and sanitizing, the commonly touched surfaces in your home. That's really good information. I know that there was some confusion maybe in the beginning of the outbreak. Some people were concerned, about the transition and who and what you could get COVID-19 from. Can you get COVID-19 from your dog?
There's no data that you can get COVID-19 from your pets right now, either dogs, cats, guinea pigs, parrots. That's no data that they're spreading the disease, so it's still safe for you to play with your dogs and play with your cat. If you are petting them, it's always good to wash your hands afterwards. You'll hear nurses and anyone else who works in public health, we love to wash our hands. You should wash your hands after everything. So I would still recommend washing your hands and not touching your face, but that's just for basic. They spread other things, like dust and dander that help people, but not COVID that we know so far.
Yeah, we know so far. That's important to know. The landscape is always changing as far as infection goes. Great. Okay, so say, Jamie, I'm at home and I'm not feeling great. I have a fever, I have a dry cough. What should I do then? Should I try to get tested for COVID-19? What's the best recommendation for that?
So the best recommendation that we're saying right now is you shouldn't go anywhere without calling first. So I know also Washoe County Public Health Department, they have a line that you can call if you think that you have these symptoms. There's also, you can look it up online. There's little click boxes you can do just to see if you would need to get tested or not. They're not testing everybody right now. They're only testing people who show symptoms. So if you're showing symptoms that sound a lot like coronavirus, then you'll go to the hospital. If you have really mild symptoms, you can just recover at home like you would do if you had the flu. There's no medicine that you take for the coronavirus specifically. You would just take Tylenol for your fever, drink lots of fluids, the things you would do for flu right now.
That's really, really important to remember. Definitely calling ahead to make sure that those services are available and that you can get the care. That's very important right now. What else can people do? What else can someone do to protect themselves from getting COVID-19?
Right now, the biggest thing that we can do is everything that they've been telling us. We need to make sure that we're washing our hands. We need to make sure that we're staying away from crowded places if at all possible. Like I said, we all still need to go grocery shopping. That's not going to stop. You should wear a mask when you're out in public. If you're going to cough or sneeze, don't cough in your hands. try to cover the crook of your elbow or your shoulder. That'll help you, that will help prevent the spread from your hands to other surfaces. And just stay home. If you can stay home at all, stay home. I know I have been home for a month and I'm going a bit stir crazy, but it's just the safest thing for all of us right now is staying home.
That's really, really important to remember. When we stay home, we're helping, prevent the spread of disease. We're helping alleviate the burdens on our healthcare workers, and we're keeping our state safe. Thank you so much, Jamie, for joining us and for sharing your expertise today. On behalf of Immunize Nevada, I would like to thank you all for submitting questions and for viewing our talk today. For the latest information on the coronavirus, as well as for links to state-specific resources, we invite you to check out and subscribe to our COVID-19 brief, which is available on our website at immunizenevada.org. That's all of our time for today. Thank you again, Jamie, for joining us.
Thank you for having me.
I remind everyone to stay healthy, stay safe, and stay home for Nevada. Thank you.